Welcome to today's Resource Cafe, Thrive in the U5 Resource Cafe. My name is Nadia. I'm really pleased to have Diego Bernal with us with Pima County Health Department. We made the trek all the way over here to the Teresa Lee Clinic, and one of the reasons we wanted to talk to Diego today is because Teresa Lee Clinic traditionally has been known as the main clinic we go to in the Tucson area for reproductive and health services. So given the current state of affairs and the limitations there are even more now on access to reproductive health services, I'm really excited to talk to you, Diego, and hear about what the county is doing in response and what information we can give folks on how to access these services. So thanks for taking the time.
Yeah, no problem. I'm excited. It's definitely important to get these resources and understanding to the public, like what's going on.
Definitely.
And how the health department is helping out.
I love it, and I love it because our public health department is for everyone. It's created for folks who maybe have not had a lot of access to medical care, public health services. With the pandemic and COVID, all of us learned the hard way how important public health is. And now again, with these limitations on our access to some other services, more important than ever to get the word out. So Diego, like I said, making the trek over here, it's not close. We are about 8 miles away from the Pascuayaki Pueblo tribal land, which is not very close to the center of town, and certainly it's quite a trek from our community in the Thrive area. So can you tell us a little bit about what services are offered here, and then just kind of explain to folks where they can maybe go to seek services near to them, or what kind of changes are coming around the bend?
Yeah, of course. So Teresa Lee is not the only clinic. We are here located in Midvale and Valencia, and we also have a North Clinic that is on First and Prince. And what the services that we provide at these clinics is STD testing, birth control resources, pregnancy tests, and that's just with family planning. We also have immunizations. We also have services that they may need for a referral for mammograms or PAPs. So that's the Well Woman group, and so Teresa Lee is not the only place. Like, there's 2 clinics, and currently, like you said, with the state of everything, we're trying to figure out how we can provide the community with more resources.
Here we are, Teresa Lee Clinic. Already mentioned where it is. Those are the services offered here. What other clinics are in the city of Tucson, and where are those, and what services are offered there?
Yeah, so like I mentioned, there's a North Clinic, and then, so that's only Pima County health clinics that we have right now. But there are other clinics like Marana Healthcare, El Rio, and I'm missing a couple others, but there is. And the work that the Pima County is trying to do right now is trying to create a more landscape to make sure how we can provide all the resources, because we understand that our clinics there's not that many, there's only 2, and not everybody can make it out, and it's really hard. So we're trying to create a more resource area to provide all the different clinics, because right now we only know of a couple clinics, but we know there's a lot more that are providing.
There's a lot of other services. Yes, people think public health, they think Pima County, health department, but you're right, there's quite a few other community health clinics in the area. The North Clinic you mentioned for the public health department that you all run is on Stone, I believe. I'm excited we're here talking to you, because I know you were saying you're recognizing, one of the roles the health department has, like one of the roles our office of social workers has, to really increase access to resources. This resource cafe is one of the ways we are trying to do that. So when you say, change the landscape now that we want to offer more and more access, are you kind of talking about collaborating with these other health clinics and kind of coming together to make sure, you need this support to offer this, we do that, or we have clients who have needs that you provide help for, but we don't, so let's connect them. You're kind of trying to build an even stronger connection and network.
Yeah, that's exactly what we're trying to do, because what the pandemic taught us is that we, the health department, were not as collaborative as we thought we were, and understanding of how we were understanding the resources that other hospitals or clinics need. So the pandemic really helped us understand that. And so being able to do this now with reproductive services is huge, because now we're going to be collaborating and understanding the gaps. And if, like you said, if we don't have a service, we can refer them to somewhere else.
Wonderful.
And if they don't have a service, they can refer to us.
Great. Can you share with us who's eligible for the services, what they need to bring if they're coming for services, if anything, any tips people should know before they show up, and the hours?
Yeah, so our North and Teresa Lee Clinic are 8 to 5, Monday through Friday. And you can either just do a walk-in or you can make an appointment. And you don't really need anything, because we are exclusive, where we will base your fees based on your income. And if you can't even pay that, you can make it a donation. So we will never turn anyone away for the inability to pay. So they don't have to worry about insurance or an ID, as long as they're able to fill out their information on a history form, and they are golden. So we see a lot of people think when family planning, they think it's only for like women, but no, we also see men, and the age range is all over the place. It's starting maybe from like 14 all the way to 70 sometimes that we see.
Sure.
So definitely we see all sorts of people, and anybody is welcome to come. Also, what I didn't mention is that we have a mobile clinic. So this mobile clinic is a big RV that was converted into like an actual clinic. Like if you walk in, it looks like
Cool.
you're in a doctor's office.
Mm-hmm.
So this goes to, I believe right now it's 5 different schools, high schools.
Okay.
So we go to TUSD, Sunnyside District, some charter schools, and we actually provide birth control and STD testing right then and there. So adolescents don't need parent permission because it's under Title X, so it protects them. And we actually see a lot of males and females coming to do STD testing and just get education on birth control. And even if they want, they can start birth control right then and there, because we also have a nurse practitioner there.
And for folks who maybe have never even been to the doctor, right? A lot of times when we need health services, it's emergency services, because we have to have them. And I know a big barrier, even for me, going to the doctor is fear, and I don't want to go, and I don't want to hear about what is wrong with me, and I just would rather not. But we know that actually addressing these fears, addressing our health problems, there are solutions for everything. There's modern medicine, there's no barriers with the income, with insurance. So just really want to encourage folks, you're not alone, and the health department is exactly for folks in that position, because, right, you were saying,
yeah, exactly. And then most of the time we see that our patients, they don't have a primary care provider because they don't have insurance, or they just don't have the resources. So a lot of the times when they come see us, we're the only doctor that they're seeing. Right. So we are definitely trying to be all inclusive and like do a one-stop shop kind of. Great. So that's why we have different services also here.
So you were mentioning that a lot of people really know the family planning services tend to typically be geared towards women, females, people with uteruses, but that actually a lot of men access and utilize these services as well. And yet I don't think that I could even, right off the top of my head, describe all the different ways that men might be able to use these services. And like we were saying earlier, you know, a lot of folks have a lot of fear of the doctor, and a lot of folks leave things until there's no other option. So part of what we're trying to do here is really educate and offer not just resources, but information of like, this is for these reasons, maybe come in and get some preventative care in a place that's really going to be welcoming and supportive of that, recognizing that there's always that hesitation. So yeah, tell me more about what are those services?
Yeah, so it's super important because men are also having sex. So they're also involved in the family planning. Right. So being able to have them understand, like, they can still get STDs and they should get tested every time they have a new partner. because most of the time, sometimes like chlamydia and gonorrhea, they're asymptomatic, so
Right.
they don't know. And then with the current political climate, everybody's focusing on women's reproductive rights. But you gotta also focus on men. Men are part of that situation. So they have to understand that there's birth control for them too. It's either abstinence or condoms. And so being able to understand that is super important. And if they have a female partner and they want to learn more about birth control, they can also be like, hey, I just want to learn about the different types of birth control that my partner can get on. So it's a two-way road that it's super important. The more educated and more tools you have, the more you can help your partner.
Absolutely, and I would also add, like we were saying, the health department's inclusive. Also, you know, STDs, STIs, sexually transmitted diseases, infections, they don't know age, they don't know gender, they don't know race. So anybody who has any concerns about their health, not just physical, not just with our sexuality, but even with our mental health, right? We also know a lot of folks who access public health services are suffering from substance use disorder, have other situations in their life that people don't necessarily think, oh, I could go get help at a public health department for that. I know you all's expertise is in like physical health, and yet we know mental health and substance use is all tied into that. So what does the county have to offer as far as those things go if someone were to walk in the clinic with not just physical but other things that they needed help with?
Yeah, so definitely we don't offer like in the clinics mental health or substance abuse, but at our health department we have different programs that are strictly dedicated to that, and they have different resources that they can provide the community with education on how and where they can go to receive services. One of the successful programs that we've had with substance abuse disorder is that we had Narcan available, and it was able to give out for free. And so being able to just provide that service is huge.
Sure.
Because
Narcan, just to be clear, do you want to explain what Narcan is?
Yeah, so really quick, I'm not an expert on it, but it's used in case someone is overdosing on fentanyl, and it helps to for them to come out of that.
Right, and it can be used during the overdose to save that person's life in that moment.
Yeah.
Excellent. Wonderful. So again, anyone who has kind of any health issues that they might have a concern with, needing some help, needing some doctor's advice, maybe you don't have insurance, maybe you've not been to the doctor, Pima County Health Department is available for you. Diego, we really appreciate your time. We're gonna post all the information of all of the clinics, well, the two clinics, the one that's near our community and this one. And we'll look forward to hearing more about how this collaboration and how, you know, this connection with other community partners unfolds. And it'll be exciting to get an update from you all one day. Thank you so much for your time.
Yeah, no problem. Thank you.
Yeah, thank you all for watching. Please like our ASU Ocher Facebook page on Twitter, Instagram, YouTube even, and the health department as well. And I'm sure you'll hear about a lot more resources and things coming up from both of us. So thanks.